Biseptol tablets antibacterial sulfanilamide drug provides an antimicrobial agent, contains sulfamethoxazole and trimethoprim. The duration of the therapeutic action is 7 hours. Indications: treatment of infectious and inflammatory diseases caused by microorganisms sensitive to this drug. Respiratory tract infections, including bronchitis, pneumonia, lung abscess, pleural empyema, otitis, sinusitis, infections of the genitourinary system, including pyelonephritis, urethritis, salpingitis, prostatitis, gonorrhea, infections of the gastrointestinal tract, including thyroid fever, parathyroid fever, bacillary dysentery, cholera, diarrhea, infections of the skin and soft tissues, including furunculosis, pyoderma. How to use: the drug is taken orally after meals with a sufficient amount of liquid. The dose is set individually. For children aged 3 to 5 years, the drug is prescribed 240 mg, 2 tablets of 120 mg 2 times per day. Children aged 6 to 12 years, 480 mg, 4 tablets of 120 mg or 1 tablet of 480 mg 2 times per day. For pneumonia, the drug is prescribed at the rate of 100 mg of sulfamethoxazole per 1 kg of body weight per day. The interval between doses is 6 hours. The duration of admission is 14 days. For gonorrhea, the dose of the drug is 2 grams in terms of sulfamethoxazole 2 times per day, with an interval between doses of 12 hours. For adults and children over 12 years of age, the drug is prescribed 960 mg 2 times per day, with long-term therapy of 180 mg 2 times per day. The duration of the course of treatment is from 5 to 14 days. In severe cases of the disease and/or chronic infections, it is possible to increase the single dose by 30 to 50%. With the duration of the course of therapy for more than 5 days and/or an increase in the dose of the drug, it is necessary to control the picture of peripheral blood. When pathological changes appear, folic acid should be prescribed at a dose of 5 to 10 mg per day. If a dose is missed, the drug should be taken as soon as possible. If the next dose is due, the previous dose should be skipped. Do not take a double dose to make up for a missed one. In patients with renal insufficiency, the standard dose of the drug should be reduced by 50%. With cc less than 15 ml per minute, the drug is not recommended. Contraindications: established damage to the liver parenchyma, severe renal dysfunction in the absence of the ability to control the concentration of the drug in the blood plasma, severe renal failure, severe blood diseases, aplastic anemia, B12 deficiency anemia, granulocytosis, leukopenia, megaloblastic anemia, anemia associated with folic acid deficiency, hyperbilirubinemia in children, pregnancy, lactation, children aged up to 3 years, hypersensitivity to the component of the drug, hypersensitivity to sulfonamides. With caution, the drug is prescribed for folic acid deficiency in the body, bronchial asthma, and thyroid diseases. Special instructions: it is not recommended to use the drug for tonsillitis and pharyngitis caused by group A hemolytic streptococcus due to the widespread resistance of strains. With long more than a month course of treatment, regular blood tests are necessary. Since there is a possibility of hematological changes, it is also inappropriate to use foods containing a large amount of PABA during treatment. Green parts of plants, cauliflower, spinach, legumes, carrots, tomatoes. Excessive sun and UV exposure should be avoided. The risk of side effects is much higher in AIDS patients. Side effects: the drug is usually well tolerated. From the nervous system, headache, dizziness, in some cases aseptic meningitis, depression, apathy, tremor, peripheral neuritis. From the respiratory system, bronchospasm, dyspnea, cough, pulmonary infiltrates. From the digestive system, nausea, vomiting, loss of appetite, diarrhea, gastritis, abdominal pain, glossitis, stomatitis, cholestasis, increased activity of hepatic transaminases, hepatitis, sometimes with cholestatic jaundice, hepatocnecrosis, pseudomembranous enterocolitis, pancreatitis. From the hematopoietic system, leukopenia, neutropenia, thrombocytopenia, granulocytosis, megaloblastic anemia, aplastic and hemolytic anemia, eosinophilia, hypoprothrombemia, methylglobinemia. From the urinary system, polyuria, interstitial nephritis, impaired renal function, crystalluria, hematuria, increased urea concentration, toxic nephropathy with oliguria and anuria. From the musculoskeletal system, arthralgia, myalgia, allergic reactions, itching, photosensitivity, urticaria, drug fever, rash, exudative erythema multiforme, including Stevens-Johnson syndrome, toxic epidermal necrolysis, Lyell syndrome, exfoliative dermatitis, allergic myocarditis, fever, angioedema, hyperemia of the sclera. From the site of metabolism, hyperglycemia, hyperkalemia, hyponatremia,